Hello! So it's been a little bit since my last post. I'm intending on doing a lot of catching up today, but before anything else, I want to address a topic that I've been meaning to for quite some time, which is the overall structure of our healthcare system in this country. I first became interested in this topic when they did pass the healthcare reform bill, and that hasn't changed at all since everybody stopped talking about it, and especially since they're considering repealing it and all the political junk that goes in with it. I figured now was as good a time as any to address it, especially since after internal medicine I have a much different perspective, well, not that much different, but a more informed perspective on what actually needs to be done. I remember when the topic first came up in the national arena, there was a lot of discussion of death panels and coverage for illegal immigrants and socialism and what have you. And just generally speaking, my advice to people is to not believe everything that you hear, not believe all the hype that you hear in particular, and to go and check it out for yourself. No way was anybody ever going to pass something that would have denied care to people who really, really needed it. The way the system is now, as broken as it is, we don't do that. We never would do that. So the entire idea of death panels is ridiculous. Basically what that clause said was that you would be required to make a plan of what you wanted done so that if something happens, they would stick to that plan. And if you didn't want to be on a ventilator, you wouldn't end up on a ventilator. If you wanted the ventilator, if you wanted them to do absolutely everything in their power to save your life, you could have that option. But the way things are now, very few people have a plan in place of what they would want or wouldn't want in the case of really serious injury or disease. And as a result, a lot of people who wouldn't necessarily want that undergo really expensive and futile treatments that artificially prolong their life. That's what that was about. Not about a panel that decides if you get treatment or not. That's ridiculous. Also, I heard a lot of talk about, should we cover illegal immigrants or not, and, things of that nature. After working in the public county hospital, I can tell you with absolute certainty that you already are paying for healthcare for illegal immigrants. The difference is the way the system is right now, they're scared to go to regular checkups. So basically what happens is they stay as far away from hospitals as they can until they're almost dead. That's when they come into the emergency room, and that's when they get admitted, because you're not legally allowed to turn away a person who genuinely needs care the way things are right now. So basically all the funding, all the resources, everything that you would need to take care of the entire population, and I'm not just talking about citizens, is already being used. It's just being used really, really stupidly. And any meaningful reform would have to address that, would have to open up primary care, and by primary care, I mean your standard doctor checkups to everybody. Catch problems when they're small, when they're treatable, and reduce the pressure on emergency rooms and public hospitals in general. The more people who can be treated from home or on an outpatient basis, the better off we all are. Not just people who need care, but people who are giving care as well, because it sucks when your hospital is entirely full. That said, as for this reform, I don't personally believe that it goes far enough. I read an interesting article recently that was written by a lobbyist for the healthcare industry who only recently has discovered the error of his ways after being paid handsomely for what he did. And he talked about the various ways in which he manipulated public opinion and instructed ways that people could spin ideas to sound negative or what have you. And he agreed that by far the best work he did was getting the public option killed. The thing is, the thing that people seem to be forgetting these days about capitalism is that the best thing about it is its emphasis on competition. If there's no competition, then a very small number of people have the ability to set whatever price they want for these things. The beauty of the public option is that it would have required insurance companies to start competing, not just with each other, because they're all in the same little club. They all know each other, but with the government, with something that was controlled by the people that would remove the profit option or the profit motive from providing healthcare. And the greatest disservice we did to ourselves was allowing that to be taken out of the healthcare reform. So should it get repealed, I wouldn't be too upset because I don't think it does everything that it needs to do. And anybody who watches this who disagrees with me is more than welcome to write me a message about it, and we'll get into it. Likewise, by far the best thing we can do to reduce our healthcare costs isn't denying people care, because that's not what happens as is, and frankly, it's not moral to do that. The best way we can reduce our healthcare costs is by making everybody healthier. Lifestyle is the most important thing. So if we're so worried about the deficit, perhaps we should stop giving subsidies to farm companies that are making corn, for example, and producing all that high fructose corn syrup that miraculously ends up in pretty much every food that we consume. Likewise, the oil companies and cars and things, I genuinely believe that bicycles have the ability to save the world. It's the solution to global warming and obesity wrapped up in one neat little package. And if we could only make it socially acceptable and, provide lockers and showers and ways that people could incorporate it into their lives, I believe that we all would benefit. Less traffic, less obesity, less health problems, everybody's happier. So the other thing that I heard a lot was that, if we allow a public option or government takeover of healthcare, that it's going to be just like the post office. What's wrong with the post office? I've never waited more than 20 minutes at the post office, and I can give a package to the person behind the counter. It'll get where it needs to go. I've never had anything get lost, knock on wood. I know it happens sometimes, but things rarely get lost, and it's at a very, very low cost, so I don't really see what the problem is. Not to mention, the people talking about and then hospitals are going to be just like the post office. Those people have clearly not been to a public hospital in a very long time, if ever. People wait days in the emergency room. Days, the way things are right now. If the hospital emergency rooms could run like a post office, that would be awesome. I'd say we're doing really, really well. So my advice to anybody who cares at all about this issue or who has strong opinions would be to reconsider your position if you're against it. It's broken. It's broken. Everybody says it's broken. And rather than think of it in terms of political stances, liberal, conservative, progressive, whatever you want to call yourself, think of it in terms of what you'd like it to look like. Wouldn't you like everybody to be able to get care? Wouldn't you like it all to be a little bit more efficient? Not to mention the mountains and mountains of paperwork that insurance requires that doctors fill out. We actually adjust a lot of treatments for people who don't have insurance, or this medication isn't covered, or lots and lots of people don't get procedures or tests or images that they need because their insurance doesn't cover it. So it's also a personal issue because, if you didn't buy the right insurance, you're not going to get the best care. And you could very easily suffer from that. So it's something to think about. And I'm sure we'll talk more about this soon. And until then, have a great day.